Facebook's working now. God. Device camera. Yeah. Okay. Okay. Oh no, not okay. Go live. 20 minutes later. Jeez Louise. Anyway, thanks, my doddy, for telling me that. Right, I think I've got this working now. Goodness me. So, yes. So, yeah. So there is a potential for damaging your implants if you were to have significant trauma, like falling off a horse or having a road traffic accident. But as I say, you damage your body. Sorry, Instagram. I'm saying it again for Facebook and YouTube and TikTok. You damage your body a lot more. So, you know, I wouldn't make that a big deal. But also, there's a potential if you do a lot of horse riding, you could get little bits of trauma, which could cause scarring around the implant and could make capsular contracture come more quickly. So that's another thing that could happen. So that's another reason to be thinking about it if you do ride horses for a living. But I wouldn't let Matt, you know, it's like anything. You've got to put the pros and the cons. That goes into the cons. So you've got to think about what the pros are for you as to whether it's worth having implants or not. But certainly there's probably a couple of cons you'd have to think about extra over and above someone who doesn't perhaps ride horses for a living. So yeah, good. We're on track. So what have we got here? I'll tell you what we've got here. Can we remove a boil? No, we don't get involved with things like boils and kind of infected things. So a boil would be like an infected, like an abscess, like a spot, or maybe a cyst, or so a boil is kind of a collection of pus, I guess, and it's an infection. And the treatment of that is to if there's surrounding cellulitis of the skin, you might think about antibiotics. If there is a collection of pus inside, then you need to let that pus out, which means draining it, incision and draining, they call it, which means basically opening up the boil and letting all the pus and the badness out. And that would be maybe A&E, maybe general surgery, maybe the GP would help with antibiotics. I'm not sure if they would kind of open it up, but maybe they would. But those sorts of people, we don't get involved with them when they're infected. Once the boil has been treated, if there is something left behind, like for instance a cyst, we can certainly help to remove that. But you'd want to wait a few months for the infection to settle down, because you don't want to do the sort of surgery we do, which is the definitive surgery to remove the cyst in the presence of infection. You want the infection to have settled. Can I have an areola reduction and inverted nipple correction at the same time? Areola reduction, yeah, you can. It's interesting. I don't think I've ever done it. I've done quite a few areola reductions and quite a few inverted nipples. I've never done them both at the same time. Just trying to think of a reason why not. I mean, the thing about the inverted nipple, you do worry about the blood supply of the nipple, but I don't think an areola reduction is going to significantly reduce that. I think you'll be okay, yeah. Yeah, it should be fine. Can you treat tubular breast deformities without implants? Absolutely, you can. So tubular breast, tuberous breast is a word used for there's a specific group of features which will make up a tuberous breast or a tubular breast. And I think what happens is a lot of people use the term, which maybe is not specifically tuberous breast. A tuberous breast, tuberous and tubular, kind of same thing. I say tuberous, but anyway, patient here said tubular, so we'll go with tubular. A tubular breast has normally got a narrow base, constricted in the lower pole, nipple areola complex herniation, so it's got a specific shape, and so you have to do things to address the shape, and that can invites me to co-host. Do I accept or decline? Do you want me to co-host something there? So implants are an aspect of treating tuberous breast to give volume and to maybe give width to the breast, because often the breast base is narrowed, but it's certainly not the only thing. And if you don't want implants, there are other things you can do. You can address the nipple areola herniation. The nipple is obviously often a bit too big and that can be reduced, as well as it's kind of herniated, protruding. The breast shape is often not right, so a breast lift can address the breast shape. So certainly you can address the breast shape, you can address the shape of the areola without using implants. But as I say, implants are commonly used to add volume and give width to the breast, because it's often a little bit deficient in the lower part and narrow. But I guess if you've got good breast volume, then we could use the breast tissue that you've got to try and reorganize things and give a better shape. So by no means do you have to have a implants if you're treating a tuberous breast or a tubular breast. Saying hi to people on TikTok. Hi everyone. Can we remove a pilomatrixoma? Yes, we can. So pilomatrixoma, also known as a calcifying epithelioma of Malherbe, little calcified lumps. Often you don't know that they're pilomatrixomas. You can often you can think that it might be one, but it feels the same as a cyst, but they're a bit more calcified. They're usually a bit harder than cysts, but they're subcutaneous lumps. And so patients normally just come presenting with a lump. They don't know whether it's a cyst or a pilomatrixoma or what it is. So sometimes you remove them and find that they are actually pilomatrixomas, and it's certainly, very easy to remove. In fact, easier than a cyst to remove, because they tend not to burst and all the stuff goes everywhere with a cyst. You have to be a bit careful with a cyst, because if you breach the cyst wall, it can all sort of start to come apart. So in some ways they're a bit easier because they're a bit harder. There's what's that called? They're easier because they're a bit harder. That's probably called something, isn't it? Is that an oxymoron? What's an oxymoron? Anyway, it's probably called something, but that's one right there if you want one. Pilomatrixomas are easier because they're harder. Okay, thank you. I'm here all week. Can we remove a perianal skin tag? Well, the answer to that in terms of a strict yes or no is a yes, because skin tags are usually quite simple to remove, and on paper we can remove skin tags wherever they may be. But this patient has actually sent us a photo, and it's not a skin tag. It's quite a prolific florid lesion that I would recommend a general surgeon remove, because they're sort of more au fait with treating things in that area. So if it was just literally a little skin tag, you tend to just snip the paste. Sometimes you don't even need to put a stitch in, just maybe a little bit of a buzz to stop the bleeding. Skin tags are relatively simple to remove, and a perianal skin tag should be as okay, but we probably need, that's why we need to see a photo really. I know it's difficult, especially in areas like that, but we need to see a photo, because if you come to clinic and then we say we can't do it, sometimes that can be a bit distressing if you built yourself up to come to clinic, etc. So finally got there. Probably took as long doing the Q&A as I did getting it set up. So anyway, I've got to go and carry on the birthday celebrations. So if you have any other questions, then feel free to invite Ashley to join live as a guest. Does Ashley want to join live as a guest? There you are. I don't know about this joining live as a guest. I don't know if people are just accidentally pressing the button or they actually do want to join live. I'm very happy to join live. If someone wants to talk to me, I can have a one-on-one conversation. But I'm assuming people accidentally press that button. I can't imagine anyone would actually, unless you're very outgoing. But if you do want to talk live, I can talk live, Ashley or anyone else. But if no one else does, thank you for your time. Very interesting. Oh, you're too kind, Madodi. Very kind, Madodi, and thank you for letting me know that TikTok wasn't working, and you're saying it's interesting. But listen, I'm here every week, Madodi. So if you're not doing anything usually at 7, and usually not spending the first 10 minutes fiddling with the computer, but nevertheless here every week. So next Tuesday, not Thursday, Tuesday, I will be here, same time, same place. So I expect to see you there, or not if you've got something better to do, but either way I'll be here. Wow, I'm stopping the stream.